Hey everyone, welcome to This Explainer. I'm a senior pelvic floor physiotherapist, and honestly, I am so thrilled you're here with me today. My whole goal right now is to help you really understand your body during pregnancy, especially when it's throwing those painful warning signs your way. Today, we're diving into something that affects so many moms-to-be, but it kind of flies under the radar: pubic symphysis pain. We're going to break down exactly what it is, why it's happening to you, and most importantly, how we can tackle it together. So let's start with a question I literally hear in my clinic every single day. Women come in and ask, is severe pelvic pain just a normal part of being pregnant? And the answer is a massive, resounding no. I really want to validate your experience right here and now. Yes, this kind of pain is super common, but is absolutely not something you should just grit in teeth and push through. It's actually your body's way of flashing a warning light saying your pelvis is under way too much strain and it needs some backup. Okay, so what exactly is happening in there? Pubic symphysis pain, or SBD, symphysis pubis dysfunction, if we're using the fancy medical term, is basically discomfort caused by way too much movement or strain in one very specific spot. Think of your pubic symphysis as the main hinge connecting the two halves of your pelvic bones, right at the front of your body. When that hinge gets strained or stressed out, well, it sends out some serious pain signals. But why does that hinge get strained in the first place? Well, we have to look at the massive biomechanical shifts your body's pulling off to make room for your baby. First off, your whole posture changes. Your center of gravity shifts forward, which instantly changes the space and puts brand new stress on your pelvis. Second, there's the load. I mean, you've got the increasing weight and pressure from a growing baby bearing straight down on that front pelvic joint. And third, there's a totally wild hormonal shift happening behind the scenes. And that hormonal shift is driven by a little something called relaxin. It does exactly what it sounds like, right? It relaxes your ligaments to prep your body for childbirth. Fun fact, relaxin actually hits all the joints in your body, which totally explains why you might feel a bit more clumsy or wobbly during pregnancy. It's an amazing, absolutely vital hormone for birth. But because it makes your pelvic ligaments so incredibly loose, they kind of stop doing their main job of supporting you. That lack of support creates instability around your pelvis, and that is the main culprit behind SPD. So you might be thinking, okay, is this what I have? Let's run through the classic symptoms. You might get a really sharp pain right at the pubic bone, or maybe it feels more like a deep burning or pulling sensation in your lower pelvis. A lot of the time, that pain shoots out into the groin, the hips, or down the inner thighs. And honestly, it's super common for patients to tell me they actually feel a physical clicking or grinding sensation right at the pubic bone when they move. Ugh, not fun, right? And all this instability spills over into your everyday life. This is where it gets incredibly frustrating. Because that front joint is unstable, the most basic, simple tasks turn into major triggers. Just walking across the living room, heading up the stairs, or even just rolling over in bed at 3 a.m. can cause a massive flare-up. Even getting dressed, like standing on one leg to put on pants, or just parting your legs to hop out of the car, can bring on that sudden, sharp zap of pain. Now, a huge, totally understandable worry that brings expectant moms into my clinic is this: is SPD going to affect my labor or delivery? I want you to take a deep breath, because I can absolutely reassure you here. The vast majority of women dealing with pubic symphysis pain can definitely still have a completely normal, safe vaginal birth. What we do in physiotherapy is actually teach you safe, specific birthing positions that protect that front joint, making sure it doesn't get overstrained while you're delivering your baby. And if you're thinking about coming in for help, don't stress about the medical testing part. The really great news here is that diagnosing pubic symphysis pain is super straightforward. It's totally hands-on and usually needs zero imaging. No scary x-rays, no claustrophobic scans. We just sit down, take a thorough history of exactly what you're feeling, do some really gentle palpation of the area, and check out your movement and deep core function. It is completely safe and totally non-invasive. All right, let's move into our next section: effective pain management strategies, where we talk about taking control of SPD. Let's dive right into what you can do at home, like today. First things first, rest when your body tells you to, and be super mindful of your posture. Grabbing a pregnancy support belt can be a real game changer. It acts like a temporary set of ligaments, giving your joint a nice supportive hug. For the pain, heat or cold therapy is fantastic, but listen to me on this one. Always put a few layers of towels between the pack and your skin so you don't irritate it. And lastly, try to tweak your movements. Avoid wide stances and try not to load all your weight onto just one leg. Now, what actually happens when you come into the clinic to see a pelvic floor physio like me? Let's take the mystery out of it.
Your patient journey kicks off with that gentle assessment and diagnosis we just talked about. From there, we jump into stabilization exercises that are totally tailored just for you. Then, we mix in some hands-on manual therapy. And finally, we get you set up with ongoing pain management and taping strategies so you stay fully supported between your visits.
Honestly, the secret sauce in that whole journey is the targeted exercises. Remember how we said the hormone relaxin sort of robbed you of your ligament stability? Well, we have to step in and replace that with muscle stability. And we do that by safely waking up and strengthening your deep core and pelvic floor muscles. Don't worry, we're not talking about intense, sweaty boot camp workouts here. These are highly individualized, really subtle movements meant to boost that pelvic support without making your current pain any worse. And we pair those exercises with some pretty fantastic clinical tools. Manual therapy is basically hands-on soft tissue and joint mobilization. It helps melt away muscle tension and gets those pelvic bones aligned properly again. Then we often use kinesiotaping. This is a specialized tape we apply right to your abdominal wall. And the best part is you literally wear it home. It works all day long, continuously pulling the tension away and taking the stress right off that pubic symphysis. Looking ahead, the other big question I always get is this just going to magically disappear after I have the baby? I want to be super straight with you here. For a lot of women, yes. Once the baby arrives and that heavy load is gone, they see a massive improvement. But, and this is a big but, early physiotherapy intervention is absolutely crucial. We really need to actively restore your deep core function and fix any wonky postural habits you picked up. Otherwise, you run the very real risk of dealing with chronic pelvic instability way down the road. So, if you're in the thick of this right now and you're looking for specialized care, we would love to see you at OVA Women's Health over in Burnaby. We are international experts when it comes to pregnancy-related pelvic pain, and we bring a ton of clinical experience to every single appointment. We've actually successfully treated over 2,000 complex pelvic pain cases. We know exactly how to customize your care to perfectly match the unique, crazy changes your body is going through. Seriously, help is so much closer than you think. You can just scan the QR code to learn a bit more about our evidence-informed approach, or go ahead and book an appointment directly with our team. I want to leave you with this one thought. If your body is literally screaming for support today, why spend even one more day of your pregnancy trying to just push through the pain? Thanks so much for hanging out with me for this explainer, and I truly can't wait to help you reclaim a comfortable pregnancy.